Officials in Thailand said Monday, February 3, 2020, that a second patient has been treated with a new combination of HIV and flu drugs after doctors said the cocktail had been successful in treating a 71-year-old woman from China with the virus. Officials have yet to provide an update on the success of the treatment for the second patient. In hospitals, doctors and nurses are sometimes treating COVID-19 patients with the antiviral drug oseltamivir or Tamiflu, which seems to suppress the virus's reproduction in at least some cases. This is somewhat surprising, Michigan Tech virologist Ebenezer Tumban told Live Science, as Tamiflu was designed to target an enzyme on the influenza virus, not on coronaviruses. In China, doctors are also testing an array of other antivirals originally designed to treat Ebola and HIV, Nature Biotechnology reported. A team of German virology, genomic and pharmaceutical scientists at the Leibniz Institute for Primate Research has identified an existing Japanese drug called chemostat mesylate, trade name Foipan, that could treat the COVID-19 disease that is caused by the SARS-CoV-2 coronavirus. Beijing has already begun recommending the drug favipiravir, developed by Fujifilm Toyama Chemical and sold under the brand name Avigan. It is very safe and clearly effective, said Zhang Xinman, director of the Science Ministry's China National Center for Biotechnology Development, in a news conference. Avigan was given only conditional approval in Japan in 2014 to treat novel or re-emergent influenza, not the seasonal flu, and is produced only at the request of the government, which stockpiles it for emergencies. Avigan isn't available at hospitals or stores, though it received a boost later in 2014 when it was used to treat patients of the Ebola outbreak. Avigan has been found in clinical trials to be effective in treating the virus, particularly in early stages of the disease. Treatment for the coronavirus requires about 120 tablets, which is 3 times the Avigan dosage to treat influenza. The country currently has a stockpile for 2 million people to treat the flu, or just 40 doses per person. Japan is now relying on favipiravir to help fight COVID-19, as are countries such as Turkey. The antiviral pill works by inhibiting the replication of viral genes within infected cells, thereby mitigating the virus's ability to spread from one cell to another. The Fujifilm team is in the middle of a clinical trial using the antiviral pill that will conclude in June 2020. The Japanese government is awaiting the results of ongoing tests but is expected to officially approve the drug for use against the coronavirus this summer. Other drug treatments have been tested for COVID-19 treatment and are in the process of development, but no antiviral has yet been approved or created specifically for dealing with the new coronavirus. While drugs to treat patients with COVID-19 and vaccines to prevent infection are being developed, a fast-acting, stopgap serum therapy could be useful as a first aid for high-risk patients. High-risk groups include older people, around the ages of 70 or 80, and people with existing, serious conditions, and that may also include younger people. Doctors in Shanghai are using infusions of blood plasma from people who have recovered from the coronavirus to treat those still battling the infection, reporting some encouraging preliminary results. Lu Hongzhu, professor and co-director of the Shanghai Public Health Clinical Center, said the hospital had set up a special clinic to administer plasma therapy and was selecting patients who were willing to donate. Health officials in the United States and China have set ambitious goals for getting a vaccine to initial human testing within the next few months, although drug makers cautioned that they have a long way to go. Teams around the world are racing to produce a vaccine, with some vaccine candidates already being tested in animals just weeks after the coronavirus DNA sequence was released. It is this genetic drift that means new flu vaccines have to be created each year, and that means getting the flu once does not mean you'll be immune next time it comes around. The coronavirus is not expected to mutate this rapidly, and so once a vaccine is here, it should continue to work far into the future. Coronavirus immunity differs from other diseases. Immunizations against smallpox, measles or hepatitis B should last a lifetime. Coronaviruses interact with our immune system in unique and different ways. For coronavirus, people retain immunity for about 1 to 2 years, although the long-term response to being exposed to the virus again may depend on the severity of the original infection. The WHO said it was way too early to predict the end of the epidemic. This outbreak could still go in any direction, the Director General warned. While the world worries about the spread of the deadly coronavirus, now known as COVID-19, one would expect the major pharmaceutical firms to make millions, even billions, by rushing to develop a vaccine. But in reality, this is not the case. While the global vaccine market is expected to grow to $60 billion, £46 billion this year, big profits are not guaranteed. Dr. Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases, said no major pharmaceutical company has come forward to say it would manufacture a vaccine for COVID-19. He called it very difficult and very frustrating. Sanofi expects to have a vaccine candidate to test in the lab within 6 months and could be ready to test a vaccine in people within a year to 18 months. Approval would likely be at least 3 years away, the company said. Fears over the effect of China's lockdown on global growth have slashed more than 22% off the price of the Brent global crude oil benchmark since its recent peak on January 8, 2020. The yuan currency had its worst day since August 2019, and Shanghai-traded commodities from oil to copper hit their lower limits, all despite the central bank's injection of 1.2 trillion yuan, $174 billion, into money markets. In China, Wuhan used to be known as a city of cherry blossoms, an economic engine of the central heartland, and the birthplace of a revolution that brought down the country's last imperial dynasty. But now, the city has become the face of the deadly novel coronavirus outbreak, and fears have fueled resentment and discrimination against people from Wuhan. Poor sanitation, particularly in rural areas, and the trade in wild animals were recognized as problems after the 2003 SARS outbreak. A patriotic hygiene campaign was launched, and officials vowed to enforce tighter regulations on the trade in civet cats, which were blamed for spreading SARS and other wild meat. Neither of these campaigns had far-reaching effects. Hygiene remains an issue in many areas. A toilet revolution was launched last year, and civet cats were found to be on sale at Wuhan markets. New cases of infection with a novel strain of coronavirus, which emerged in the Chinese city of Wuhan, are being reported daily around the world. In China, at least 425 people have died, the government said on Tuesday, February 4, 2020. At least 20,438 people have been infected across the country. Hong Kong reported its first death from the newly identified coronavirus on Tuesday, February 4, 2020, the second outside mainland China from an outbreak that has killed more than 420 people, spread around the world, and raised fears for global economic growth. China has agreed to allow U.S. health experts into the country as part of a World Health Organization (WHO) effort to help fight the fast-spreading coronavirus as the number of cases and deaths continued to mount. A Chinese newborn has been diagnosed with the new coronavirus just 30 hours after birth, the youngest case recorded so far, state media said. The baby was born on 2 February in Wuhan, the epicenter of the virus. The baby's mother tested positive before she gave birth. It is unclear how the disease was transmitted in the womb or after birth. But it is also possible that the baby was infected after birth from having close contact with the mother. Very few children have tested positive in this recent outbreak, which is consistent with other coronavirus outbreaks in recent history, including SARS and MERS. A report by the Journal of the American Medical Association (JAMA) said the median age of patients for the current outbreak is between 49 and 56 years, adding that cases in children have been rare. This week, it brought chaos to the sedate world of luxury ocean cruises. About 3,700 people on Carnival's Diamond Princess, docked off a Japanese port, face quarantine for at least 2 weeks on the ship, which has 20 virus cases, with testing continuing. Japan now has 45 virus cases. In Hong Kong, a cruise ship with 3,600 passengers and crew was quarantined for a second day pending testing after 3 positive cases on board. At a briefing in Shanghai, a mental health official, asked how people could avoid stress over the outbreak, said they should not watch too much news but enjoy television soap operas instead. A whistle-blowing Chinese doctor who tried to raise the alarm about the coronavirus outbreak has died. Li Wenliang, 34, was declared dead at 2:58 a.m. local time on Friday, February 7, 2020 morning, after emergency treatment at a hospital in Wuhan, the Global Times reported, following hours of confusion over his fate. Chinese police had targeted Li for spreading rumors in late December 2019 after he posted a warning on social media about a cluster of cases of a flu-like disease that had been treated at his hospital. Li later developed a cough and fever before he was hospitalized on 12 January 2020 and began to have trouble breathing. In Wuhan, the largest city in Hubei, hospitals were struggling to find enough beds for patients. A 1,500-bed hospital opened on Thursday, February 6, 2020, just days after a 1,000-bed hospital with prefabricated wards and isolation rooms began taking patients, but senior officials said the city of 11 million was close to capacity with only 8,254 beds for 8,182 coronavirus patients. A highly contagious patient, virus transmission inside a hospital and unexpected turns for the worse have emerged as part of the epidemic in China. One patient, admitted to a hospital in Wuhan, China, infected at least 10 healthcare workers and 4 other patients. Chinese researchers have said the pangolin, an endangered mammal illegally trafficked for its scales and meat, is a potential intermediate host for the coronavirus. The pangolin is considered the most trafficked animal in the world, and an estimated 1 million were smuggled from 2000 to 2013. The head of the World Health Organization has warned that confirmed cases of coronavirus being transmitted by people who have never traveled to China could be the tip of the iceberg. The detection of a small number of cases may indicate more widespread transmission in other countries. If China's lockdown has not worked, there is another unpalatable truth to face: that the coronavirus might not be possible to contain. Then the world will have to switch tracks. Instead of trying to contain the virus, it will have to work to mitigate its effects. The coronavirus epidemic could spread to about 2/3 of the world's population if it cannot be controlled, according to Hong Kong's leading public health epidemiologist. Most experts thought that each person infected would go on to transmit the virus to about 2.5 other people. That gave an attack rate of 60 to 80%. Elsewhere, independent self-sustaining outbreaks in major cities globally could become inevitable because of the substantial movement of people who were infected but had not yet developed symptoms and the absence of public health measures to stop the spread. Around the country, workers have begun trickling back to offices and factories as the government eased some restrictions on work and travel. In Beijing, roads were busier than they have been in the last few weeks, but normally packed trains were nearly empty. The few commuters seen on the street or using public transport were all wearing face masks. Many businesses have asked their staff to work from home. Hubei province, which has been hardest hit by the crisis, remains in lockdown, with train stations and airports shut and roads sealed off. The outbreak has caused huge disruptions in China, with usually busy cities becoming virtual ghost towns over the past 2 weeks, as Communist Party rulers ordered communities sealed off, cancelled flights, closed factories and shut schools. The outbreak has wreaked havoc across the global tourism industry, which has become increasingly reliant on Chinese visitors. The number of Chinese people going abroad grew rapidly to 150 million in 2018, and operators have responded by designing packages specifically aimed at them. Italy's National Hotel Association, Federalberghi, has said the country the most popular destination for Chinese visitors to Europe, recording 3.5 million in 2019, could lose billions of euros as Chinese tourists cancel hotel bookings amid a flight ban. Ignazio Visco, the chief of the Bank of Italy, has also warned that the coronavirus outbreak could seriously affect the country's already weak economy. In just a month, the coronavirus outbreak has snowballed from a handful of cases to more than 40,000, reaching 4 continents and prompting an all-out battle to stop the spread across China and beyond. The new coronavirus is henceforth known as COVID-19, the World Health Organization has announced. The UN agency has warned of drastic consequences if it reaches unprepared nations. China on Wednesday, February 12, 2020, reported its lowest number of new coronavirus cases since late January, lending weight to a prediction from its senior medical advisor that the outbreak could be over by April 2020. While Chinese officials said the situation was under control, the World Health Organization warned the epidemic posed a global threat potentially worse than terrorism. China's announcement of a tariff cut on some imports from the United States, which analysts saw as a move to boost confidence. The virus has shut down cities and factories in China and disrupted global air travel. Even if the epidemic ends soon, it has already taken a toll on China's economy, with companies laying off workers and other firms needing loans running into billions of dollars to stay afloat. Supply chains for car manufacturers to smartphone makers have broken down. Some of the coronavirus test kits shipped to labs across the U.S. are not working as they should, the U.S. Centers for Disease Control and Prevention said. As a result, the CDC is remaking parts of the test kits after some produced inconclusive test results. Pharmacies in the eastern Chinese city of Nanjing have been banned from selling all fever and cough medicine in the hope that residents with fever or coughing will seek treatment in hospitals instead, Nanjing's propaganda department posted on its official Weibo account. China's Hubei province has registered the highest ever one-day total of infections and deaths from coronavirus following a change in how it counts cases. Authorities had been optimistic that infections had peaked. The skyrocketing number of new cases in Hubei comes after health officials announced Thursday, February 13, 2020, they had begun including people diagnosed using new clinical methods in official statistics. Previous diagnostic methods were restricted to nucleic acid tests, which identify genetic information to detect viruses but can take days to process. Last week, Hubei's Health Commission said it would begin using CT scans to identify lung infections, which would expedite treatment. Most of this was down to Hubei using a broader definition to diagnose people, said Mike Ryan, head of WHO's Health Emergencies Program. A sharp increase in reported COVID-19 cases in China is due to a change in counting methods and does not represent a significant change in the trajectory of the outbreak, said Michael Ryan, head of the World Health Organization's Emergencies Program. He suggested the best hope in the near future lay in the trials of existing antiviral drugs, which include some that are in use against AIDS and HIV. 2 weeks ago, Chinese doctors confirmed they had been giving anti-HIV drugs to coronavirus patients in Beijing, based on a 2004 study published after the SARS outbreak that showed favorable responses. Trials have started in China, and it is hoped they will be extended to countries such as Singapore and Japan, both of which have significant numbers of cases. You can imagine being a frontline clinician at the moment. Knowing which drug works would be a magical gift, said Ryan. The U.S. Health Department is working with the pharmaceutical firm Regeneron to develop a treatment using a class of drug that has boosted survival rates among Ebola patients. Scientists around the world are also working to develop a vaccine, which experts say could take months. Official media in Vietnam have reported that a commune of 10,000 residents northwest of the capital Hanoi was put in lockdown due to a cluster of cases there. Tokyo Olympic organizers reiterated on Thursday at the start of 2 days of meetings with the International Olympic Committee. The Summer Games will not be waylaid by the coronavirus that is spreading from neighboring China. Weeks after the outbreak of a novel coronavirus in Wuhan, China, researchers are still not sure how it spreads between humans and how to neutralize it. While the mortality rate is relatively low, the quick spread of the virus triggered shock waves worldwide. By mid-February, cases were reported in more than 20 countries. Chinese authorities announced that 1,716 health workers had been infected as of 11 February. 6 had died. The Wuhan government has acknowledged the shortage of medical supplies, such as specialist N95 respiratory masks, goggles and protective suits. Hospitals across Wuhan have pleaded for help repeatedly on social media, calling for more donations of the protective gear, which are vital in protecting frontline staff from catching the virus from patients. Apart from the lack of masks, gloves and protective suits, medical workers have also been stretched to their limits by the crushing workload. Cross-infections among hospital staff are thought to have taken place in tea rooms and meeting areas after long grueling shifts. According to a study of the first 425 confirmed cases of the coronavirus in Wuhan, published in the New England Journal of Medicine last month, 7 healthcare workers in Wuhan had already shown symptoms of infection between January 1 and 10. But on January 11, the Wuhan Municipal Health Commission was still insisting that as of now, no infection among medical staff has been found, reiterating that there had been no clear evidence for human-to-human transmission. The World Health Organization also said in its statements on January 14 and 17 that China had not reported any cases of infection among healthcare workers. It was not until January 20 when Zhang Nanshan, a government-appointed respiratory expert, declared on state broadcaster CCTV that the new coronavirus could spread from person to person that the infection of medical workers was revealed. On Friday, February 14, 2020, Doctors Without Borders Medecins Sans Frontières (MSF) said that it would send 3.5 tons of medical protective equipment to Wuhan Jinyintan Hospital, one of the hospitals at the forefront of treating patients with the virus.